Hello, everyone, and welcome back to the Edu Metaverse podcast. I'm Jess, and today we're talking about a career that is both challenging and incredibly rewarding nursing. In the studio with me is Richard, a pediatric nurse who works with children and young people. Richard, thank you for coming in.
Thanks, Jess. It's lovely to be here and hopefully share a bit about what nursing is really like.
Let's start at the beginning. Many of our listeners are middle school students who may not know exactly what a nurse does. Could you explain, in simple terms, what your role is as a pediatric nurse?
Of course, a pediatric nurse is someone who cares for children in hospital, from tiny babies who've just been born all the way through to teenagers. My job is to look after their health, give medicines, check their vital signs like heart rate and temperature, and support doctors with treatments. But it's not just about the medical side. Children can be frightened in hospital, so a big part of my role is reassuring them and their families, explaining what's happening, and making sure they feel safe.
That sounds like a lot of responsibility. Did you always want to be a nurse?
Not at first, no. When I was your age, I thought about becoming a teacher or maybe working in sports. But I always liked helping people, and I found I had a lot of patience, which is important when you're working with children. At college, I studied science and health, and the more I learned about nursing, the more I realized it was a career where you can make a real difference every single day.
So, what kind of training did you have to do?
In the UK, you study nursing at university. It's usually 3 years, sometimes 4. You spend part of your time in lectures, learning about the body, medicines, and child development, and the rest of your time on placement in hospitals. That means you're actually on the wards, shadowing experienced nurses, and gradually taking on more responsibilities. The first time you give medicine to a patient or take someone's blood pressure, it feels scary, but there are always mentors there to guide you.
It must have been nerve-wracking at the start.
It was, but it's also exciting. You feel like you're part of the team straight away. I remember my very first placement on a children's ward. I was asked to comfort a toddler who was crying after an injection. I sat with him, played peekaboo, and he calmed down. That moment made me realize nursing isn't just about medicine. It's about caring for the whole person.
That's such a powerful story. Now, Richard, let's be honest, nursing is not an easy job. What would you say is the hardest part?
That's a good question. The hardest part is dealing with very sick children. Sometimes, no matter how hard we try, we can't make them better. That's emotionally tough. There are days when you feel drained because you've given everything, physically and emotionally. The hours can also be long. Nurses often work 12-hour shifts, including nights and weekends. So you have to really love the job to cope with those demands.
That sounds incredibly challenging. How do you cope with the stress?
Teamwork makes a huge difference. Nurses don't work alone. We support each other. If I've had a difficult conversation with a parent or I've been through a stressful situation, I can talk to my colleagues. We also learn to switch off at the end of the day. For me, running and spending time with my family help me recharge.
That's really important. On the flip side, what's the best part of your job?
Without a doubt, it's seeing children get better. I'll give you an example. A little girl once came into our ward with severe asthma. She was struggling to breathe, and it was very frightening for her and her parents. We treated her, supported her through the night, and the next day she was sitting up in bed colouring pictures. A week later, she walked out of the hospital smiling. Moments like that remind you why you became a nurse in the first place.
That must feel amazing.
It really does. And sometimes the best moments are small things. Making a child laugh, holding a baby while the parents rest for a moment, or seeing a teenager open up about their worries. Those little human connections are as important as the medicine.
It sounds as though nursing requires both knowledge and compassion.
Exactly. You need the science, you need to understand how medicines work, how to spot if someone is getting worse, how to use medical equipment. But you also need to be kind, patient, and willing to listen. Families remember not just the treatment, but how they were treated.
That's such a valuable lesson for our listeners. What qualities would you say students need if they're thinking about nursing?
Curiosity, compassion, and resilience. Curiosity because you need to keep learning. Medicine is always changing. Compassion because you're caring for people when they're at their most vulnerable. And resilience because some days are tough and you have to keep going even when you're tired or upset.
And for students who are thinking, could I really do that? What would you say?
I'd say yes, you can. Nursing is not about being the smartest person in the room or never making mistakes. It's about wanting to help, being willing to learn, and working as part of a team. If you care about people, you already have the foundation. The rest you can learn.
That's such an encouraging message. Before we finish, Richard, could you sum up what's the one thing you love most about being a nurse and the one thing you find the hardest?
The thing I love most is seeing the difference we make. A child who came in frightened and unwell leaves smiling and healthy, and you know you played a part in that. The hardest thing is losing patients or seeing families suffer. That never gets easier, no matter how experienced you are. But even then, we know we've given care and comfort, and that matters too.
Thank you for being so open and honest with us, Richard. I think our listeners will really appreciate hearing the reality of nursing, both the joys and the challenges.
Thank you, Jess. If any one young person listening today thinks, I might like to be a nurse, then it's worth sharing my story.
Well, I'm sure you've inspired many. That's all for today's Edu Metaverse podcast. Thank you to Richard for joining us, and thank you, listeners, for tuning in. Until next time, keep exploring, keep questioning, and keep learning.